You're in the Seaman Family MR Research Centre, and this is the intraoperative MRI operating room. Intraoperative MRI means a magnetic resonance imaging machine, and you can see in the back, as a result of our project over the past decade, in the room is a 3 Tesla magnet that is suspended from the ceiling and can move in and out of this operating room as the surgeon wishes. And that system has been used here in Calgary for some 1,400 cases or patients, and around the world in over 6,000 patients. The other thing you'll see in this room is Neuroarm, which is a MR compatible robot. The robot right now is just at the head of this operating table. The robot has 2 arms, and connected to the 2 arms are 2 surgical tools. This robot can operate outside the magnet, and because it's MR compatible, can actually operate in the magnet during the acquisition of images from a person. You also see over top of the field a operating room microscope that represents 2 of the robot's arms, and the information is all projected to a surgeon who is situated at a workstation in an adjacent room.
And so can you just describe a couple of the advantages that you're seeing with this type of surgery over more traditional surgical methods?
Well, the advantage of having an MRI machine in an operating room is that the surgeon gets an image during the performance of surgery, rather than waiting the next day or 2 to acquire the post-op image. It is obviously wonderful that a surgeon can get images not only to plan their operation, but also during the performance of the procedure as a means to guide the surgeon in what they are doing, and as a means of assuring that surgical objectives have all been accomplished. The robot allows the surgeon to immerse him or herself in an imaging into the images at a workstation, and the robot is only to allow the surgeon to return to the surgical site with increased precision and accuracy that robotics can provide. And the robot has to be integrated, and care was taken to develop this robot in such a fashion that it can integrate into surgical procedure and not adversely affect either the anesthetist, the scrub nurse, or the assistant surgeon during the performance of the case. As I also mentioned, the robot can work inside the magnet. So for the first time, surgeons can truly operate within images as they're being acquired. And that allows the surgeon a tremendous ability to implant or to extract things from difficult places.
And you've been successful with your commercialization endeavors with this invention.
Yeah.
Can you describe a little bit about how you've developed a relationship with Canadian industry and moved that forward?
That first project, the intraoperative MRI project, began as a collaboration with our National Research Council, Institute of Biodiagnostics. And as it was shown that this was a commercially viable product, a company spun out of the project called IMRIS. IMRIS has gone on to now have some 40+ sites around our world in which they have installed this Canadian technology. Furthermore, they have brought this technology to the international meetings that take place amongst neurosurgeons and radiologists around our globe. The second project, Neuroarm, was a little bit different in that Neuroarm technology was translated at a relatively early stage to IMRIS, who are now rapidly developing the commercial product that would be distributed around our world, either to sites that have MR imaging or sites that don't have MR imaging but value the increased precision and accuracy of a robot.